Hi, I'm Dr. Pankaj Surange. I'm the director of IPSC India, that is International Pain and Spine Center. IPSC India specializes in pain management and we are specialized in spine pain interventions. So why we are more into spine, we are focusing into spine because we have seen a lot of problem facing our young population which is facing this spine problem. And the main reason we have found that it is basically because of long prolonged sitting hours, prolonged diving, lack of exercises, hardly any time to exercise. So these are the main factors along with that environmental factors. Now for spine, as we know that lot of people are suffering from the disc prolapse, or in the simple term, layman term, we call it as a slip disc. So for slip disc, earlier we had option of conservative management in the form of physiotherapy, medications, rest, and if that is not helping, the other option was surgery, open surgery. Now, as I just mentioned, a lot of young people are suffering from this problem. Everybody cannot undergo these kind of surgeries, and we know the limitations of the surgeries and what all factors which affect the surgeries also, post-surgery also, there are some failures also of the surgeries. So we cannot let them undergo this kind of surgeries, spine surgeries at the very young stage. So let me give you some examples what all we can do with the spine interventions. Suppose somebody is suffering from the slip disc, which is a very big problem. So for slip disc, now we don't have to open the spine. Now we can go with the endoscope, we can target the fragment and we can remove the fragment from the inside with just a maybe 1 centimeter of incision. Old age patients, they are suffering from osteoporotic fractures because their bones are weak. Now if these patients undergo spine surgery, the fixation is required. For fixation we need rods and screws which has to go inside the spine. Now already the spine is osteoporotic, that means weak. In this, if we add implants inside, there are a lot of problems with the patient sufferer, and there were a lot of failures because of the implant displacement also. Now for these kind of problems, we have a vertebroplasty where we can go with just a small half centimeter incision, we can go inside to the target fracture and we can fix it from inside. So the advantage of the spine interventions, as I mentioned, since we don't have to open the spine, so you can understand with the small incision, if we are doing the same procedure with the small incision, the post-operative morbidity is very less. We can admit the patient same day and we can discharge the patient same day. Same day evening or the next day morning, we'll make them mobile. Another important thing is the success rate. The success rate is very high. As compared to surgery, the success rate of these interventions is very high. So there are many myths which are in the community. So please don't go by those myths. Please follow us on Instagram or the Facebook. On our websites, we have facts available for all these myths. So please don't worry about your spine problem. You are in safe hands. We have other options available other than surgery and the conservative management in the form of spine interventions.
I'm Dr. Namrata Dabas, and I'm the regenerative pain medicine expert at IPSC New Delhi. Regenerative medicine is a highly specialized field that aims to treat a disease by enhancement of body's own healing mechanism. Stem cells are the mother cells of normal adult tissues, and they become mature tissues like bone, muscle, and cartilage. And we can harvest these cells for the purpose of regeneration after we extract them from bone marrow and fat where they are existing abundantly. And these cells have enormous potential, and they are the latest innovation in medical practice. The regenerative therapy that we use commonly by pain practitioners or pain experts are the platelet rich plasma, which is drawn from a patient's own body, and growth factor injectables. And they work for good pain relief for patients of musculoskeletal pains, degenerative disease of the spine, damaged cartilages of shoulder, knee, other joints, and of course, sports injury as well. At IPSC, we also research how these cells exactly work at the molecular level to relieve pain, and whether this therapy is really better than so many other injectable techniques that we have been using until this date. These cells actually regrow the cartilage inside these joints, and how this happens is quite interesting to know. Our clinical results are rewarding in treating patients. They prevent costly joint replacements and even treat arthritis in those patients who do not have advanced joint disease. And importantly, patients need to be carefully and fully well informed and educated about the procedure, its implications, and what to expect out of this treatment, a few do's and do nots. The future looks quite bright and promising. Regenerative strategies by using the ability of our own body to heal and restore itself as best to the original or to a non-disease state may ultimately replace many of the therapies that we have today, and really this may get much better results for the patients and the entire healthcare industry going very forward.
Well, I'm visiting Dr. Pankaj since last 5 years now. It all started with a small problem in my back, and 3 years back, my father came here with some hip problem, and there was an minimum invasive procedure which Dr. Pankaj did. I feel it's almost a miracle in my case. I mean, जिस केस में मेरे फादर के लिए कहा गया था कि आपको हिप रिप्लेसमेंट के लिए जाना पड़ेगा, उसमें हमारे को अब 3 साल हो गए हैं करीब करीब, कोई प्रॉब्लम नहीं है. मेरे फादर इन लॉ 3 महीने पहले अपनी C567 में उनकी जो स्पाइनल कॉर्ड है उसके ऊपर बोन नंबर 5, 6, 7 में का प्रेशर आ रहा है. एंड द MRI शोड कि bone almost is getting into the spine. Everybody visited, couple of doctors I'll not name, and everybody said कि it's a major operation which you will have to go through. और आप क्योंकि it's a long problem, उसमें आपको अपनी bones को cage करना पड़ेगा जिससे कि bones का pressure spine पे ना जाए. I again came to Dr. Pankaj, and again his minimum invasive procedure which he did worked as a miracle to him. 90% of his pain was relieved in a couple of hours, and in 3 days he was able to even drive, which was very, very good. And it's been 3 months now, and he's going to his office, working normally, no problems at all pain gone. His pain was coming into the left hand, and now it's all normal.
In 2013, I got injured when I was in army in 1991. That is about 27 years back. When I was in the army doctors, they always told me that you take painkillers, my condition will improve. But what happened is, because of the painkillers, the pain got aggravated. Earlier I had one disc bulge at L4, L5. So over a span of 25 years, I lived with the pain, and this was one of the main reasons why I quit army, because I could not perform my duties in the army. In 2013, I was diagnosed with two slip discs, and the herniation was so bad that I couldn't do my normal duties. In 2013, when I quit army, I met Dr. Pankaj. So he advised me that I should undergo a procedure, which is the endoscopic discectomy procedure. At that time, I was not very sure whether I should undergo this procedure, because I always felt that instead of procedure, I should go for conservative treatment. I tried all sorts of treatment. Subsequently, I again came back to Dr. Pankaj. I said yes to the endoscopic procedure. The first thing that Dr. Pankaj did was he did the endoscopic discectomy on my L5S1. This was last month, that is in the month of May 2019. The best part is after this procedure, you're just walking out from the clinic, and within 2 or 3 days, you are also driving your car and doing routine duties. What I can assure you that Dr. Pankaj has been not only a friend, and he's got a very safe pair of hands, because of which I think he makes these surgeries look very easy and comfortable to the patients. I would advise all of you who have these ailments, who are living with pain, to come forward and have an open discussion with Dr. Pankaj, and I think he will set right your pain. You don't have to live with the pain. And if you have pain, please come forward and shed your pain. I have seen many people who live with the pain till age 70, 80, 90, till their nerves get damaged and they start having neuropathic pain and all that. To block that pain, I think the best part is take preventive medication, undergo this surgery, and he's got a very safe pair of hands, and he is the best in this field. I think you can trust him, and this surgery is very easy and simple, and it's hardly 1.5 hours procedure. Just go ahead and visit this clinic. This clinic is
I'm 44 years old. I came to Dr. Pankaj Surange's clinic because I was suffering from a huge disc bulge on both my right and left side. And a lot of neurosurgeons that I visited misdiagnosed me. But when I came here, he properly saw everything and he properly diagnosed me. And he asked me to do endoscopic procedure in which the removal of the disc bulge would be done. I was so happy with this diagnosis. He gave me the proper medication. I was awake throughout the process. It was unbelievable. I was conscious throughout the time and I was very confident. He really calmed me down. The staff and Dr. Pankaj's experience is just amazing. I would recommend everybody to come to this clinic for any pain.
When I came, I had lots of pains. I was unable to walk, could not move, and the whole life came to a standstill. But now, after the procedure, the Dr. Sarang has cured me fully, and I am able to walk now. I am able to do the things independently without any pain whatsoever. I feel fresh. I don't feel fatigued, tired after the treatment, and today is the last treatment of my right leg. And after that, I would be able to walk. I would recommend all of those who are in extreme pain like me to come to IPSC Dwarka and meet Dr. Sarang here. He's a very qualified person, very qualified doctor. He'll cure your problem for sure.